An investigative journalist from Washington, Wayne Madsen, says the outbreak of the virus is raising suspicion.
I spoke to two journalists, one from Mexico City and the other one from Jakarta, Indonesia. And of course, Indonesia had a problem not long ago with bird flu. Both these journalists have been in touch with UN and World Health Organization officials, including a scientist who's dealt with Ebola virus and HIV/AIDS in Africa. And it's their conclusion, these scientists who they've spoken to, that this is a very unusual form of flu because it looks like it is a product of some gene splicing. The flu contains elements of bird flu, two forms of human flu, and various forms of swine flu. To them, it doesn't look like this is naturally occurring. The other thing is the target for this flu, as opposed to other flus, it's not the very young and the very old. It's people between the ages of 20 and 45. And the other thing is people are not contracting this from pigs. The National Pork Council here in America says pigs are not being affected. This is human-to-human contact. So people who either eat pork or are exposed to pigs are not getting this flu. Very unusual. And of course, the scientists are very alarmed by the way it's being spread and the speed at which it's being spread.
Just as it sounds, this is an influenza virus that is commonly seen in pigs. However, in rare occurrences, the virus does cause infections in humans. Swine influenza infections typically look clinically much like seasonal influenza, having symptoms such as fever, cough, sore throat, and muscle aches. Sometimes additional symptoms such as diarrhea or red eyes are also present. Typically, in swine influenza cases, there is evidence or there's information leading to that the individual had direct contact with pigs. This strain of swine influenza that's been cultured in the laboratory is something that's not been seen anywhere actually in the United States and the world. So this is actually a new strain of influenza that's been identified. The good news is what's occurring in the cases that have been found is they've been very mild influenza cases. But the uniqueness of this flu virus strain is what's concerning because it's not been seen before. I've touched our hospital partners and clinicians to be on the lookout for cases of influenza and consider testing for swine influenza. We're also working very closely with state and federal partners as part of this extensive nationwide investigation. There's not been any information definitively as to what's going on in Mexico. This is an ongoing investigation that actually is both state, national, and international in terms of communication and information. So we really don't have any information that in fact, what's going on in Mexico is linked.